Okay. So hi, evening friends, evening everybody, bache, evening everybody. I'm Dr. Sushant Soni, and in this session, I want to have a look at an important topic for our NEET PG 2022 exam. Now, this was the question. This was the question that was asked last time only. That is rapid assessment of the entire coagulation pathway. Rapid assessment of the entire coagulation pathway is performed by which test? It is performed by which test? PTK clotting time. It is performed by which test? Of course, the answer was thromboelastography. The answer was TEG. Because PT and PTK it only looks at the extrinsic or the intrinsic pathway respectively. Answer was TEG, but this forms an important topic for our future discussion and questions can very easily be asked. What happens in this is thromboelastography. Thromboelastography, have a look. Thromboelastography, it looks at both the components, that is clot formation. Thromboelastography looks at both clot formation followed by fibrinolysis. Clot formation followed by fibrinolysis. What happens in this is there are various times which are associated. एक एक करके फटाफट से देखते हैं. Starting with R. R बचे is the reaction time. Starting with R. R is the reaction time. R, that is the reaction time. It is the time between reaction time, as you can clearly see. It is the time between initiation of coagulation cascade. It is the time between initiation of coagulation cascade time between initiation of coagulation cascade to to initial formation of fibrin clot. Time between initiation of coagulation cascade to to initial formation to initial formation of fibrin clot. That is what we mean by reaction time. Time between initiation of coagulation cascade, this is where the coagulation cascade has started. Time between initiation of coagulation cascade to initial formation of fibrin clot, to initial formation of fibrin. That is the reaction time. Next, after the reaction time is K, that is kinetic time. देखो सबसे पहले तो initiation of coagulation cascade to formation of fibrin clot. Reaction has started. After reaction time, after reaction time is K. K is the kinetic time. K is the kinetic time. That is time between initial formation of clot. Clot formation has started. Time between initial formation of clot to specific clot firmness. Time between initial formation time between initial formation of clot to specific clot firmness to specific clot firmness. That is kinetic time. To specific clot firmness. कितना clot firmness दिया जाता है? The clot firmness that is taken is 20 millimeters, 20 mm or 2 centimeter clot firmness. That is kinetic time. अब kinetic time के बाद what is alpha? Alpha is the rate. Have a look at this. Alpha angle. Alpha is the rate of fibrin formation and cross-linking. जितना steep angle होगा alpha का, more is the angle of alpha, higher will be the rate of fibrin formation and cross-linking alpha. Next, maximum amplitude. Next, MA, that is maximum amplitude. This is the maximum clot strength. At maximum clot strength, देखो maximum amplitude और maximum clot strength, यहाँ तक till this point coagulation had occurred, and after this point, after maximum amplitude is fibrinolysis. Which we measure as lysis 30 or LY30. Look at this. This is LY30 or lysis 30. Lysis 30, LY30. This is fibrinolysis 30 minutes after maximum amplitude. LY30 कि इतना fibrinolysis हुआ है. This is the extent of fibrinolysis after 30 minutes of maximum amplitude. fibrinolysis after 30 minutes of maximum amplitude. So please have a very good look at this graph. Reaction time was initiation of coagulation cascade to initial formation of fibrin clot. Reaction time R. R के बाद क्या आया? Kinetic time. Kinetic time, time between initial formation of clot. Initial formation of clot to specific clot firmness. Clot firmness is taken as 2 centimeters to specific clot firmness. Alpha was the angle. Alpha was the angle. Alpha angle told us about rate of fibrin formation. It told us about the rate of fibrin formation. Alpha angle. Next is the maximum amplitude. Maximum amplitude or MA, that is the maximum clot strength. Maximum amplitude or maximum clot strength followed by fibrinolysis, which is detected by LY30. Lysis 30. Fibrinolysis 30 minutes. Fibrinolysis 30 minutes after maximum amplitude. LY30. This is TEG. Thromboelastography. These are the parameters which are evaluated by TEG or thromboelastography. Next point. So let us have a look at abnormalities associated. Let's make a master table. सबसे पहले starting with our component, starting with our first component, that is reaction time. Starting with reaction time, that was the time between initiation of coagulation cascade to initial formation of fibrin clot. Reaction time, normal value कितना है? The normal value of which is 5 to 10 minutes. Normal value of which is 5 to 10 minutes. If it is abnormal, if it is, what is the significance? If it is abnormal, that shows that there is an abnormality. There is an abnormality with respect to coagulation factors. There is an abnormality with respect to coagulation factors and therapy of the same. And therapy of the same. Coagulation factors are present in which component? Packed RBC, FFP, platelets, cryoprecipitate, they are present in FFP. Fresh frozen plasma, they are present in FFP. So the first component is R. First component is R, that is reaction time. First component is R, that is reaction time. Next is K, that is kinetic time. That is kinetic time. What was kinetic time? Kinetic time, it was the time taken between initial formation of clot to clot reaching a specific firmness. That firmness was taken as 2 centimeters. Kinetic time. Normal kinetic time being 1 to 3 minutes. Normal kinetic time being 1 to 3 minutes. Now, if the clot is not firm, that means there is a problem in fibrinogen. That signifies a problem in fibrinogen. And what is which component of blood is rich in fibrinogen? That is cryoprecipitate. What is rich in fibrinogen? Cryoprecipitate. Cryoprecipitate is rich in four things: von Willebrand factor, factor 8, fibrinogen, von Willebrand factor, factor 8, fibrinogen, and factor 13. So fibrinogen therapy is cryoprecipitate. Next is alpha angle. Alpha angle told us about the rate of formation of the clot. Normal alpha angle is 53 to 72 degrees Celsius. Normal alpha angle is 53 to 72 degrees. If if alpha angle is low, that means the rate of formation is less because of reduced fibrinogen, the therapy of which is again the same, that is cryoprecipitate. Alpha angle cryoprecipitate. Next is maximum amplitude. Next is MA. That is maximum amplitude. Next is MA, that is maximum amplitude. Maximum amplitude, it tells us about the maximum clot strength. Maximum amplitude, it is 50 to 70 mm. It is 50 to 70 mm. If the maximum amplitude is not reached, that signifies a abnormality in platelets, of course to be treated by giving platelets. Of course to be treated by giving platelets. And lastly is LY30. Lysis 30. That is the percentage of lysis which has occurred 30 minutes after maximum amplitude, L by 30. The normal value of which is 0 to 8, 0 to 8%, L by 30. If this is exceeded, that means there is excess fibrinolysis. If it is exceeded, if it is exceeded, that means the fibrinolysis is excessive. Excessive fibrinolysis has occurred. The fibrinolysis is excessive. To be treated by transamic acid. Fibrinolysis is excessive. To be treated by transamic acid. To be treated by transamic acid and aminocaproic acid. To be treated by transamic acid and aminocaproic acid and aminocaproic acid. This is thromboelastography. This is thromboelastography. Please have a good look. Please have a good look at this table. Extremely important. Let me write 50 properly only. So 50 to 70 mm. This is the master table. एक बार बच्चे दोबारा देख लो. Whenever a question will come on TEG, entire coagulation pathway देख रहा है. Entire coagulation pathway देख रहा है. Firstly, secondly, it is evaluating both clot formation as well as fibrinolysis. Reaction time between initial coagulation cascade to initial formation of fibrin. Kinetic time, जब तक वो specific clot firmness पे नहीं पहुंच जाता. Maximum amplitude, which was 50 to 70 mm. L by 30, which is evaluating fibrinolysis. So if fibrinolysis is excessive, in that case we give transamic acid and aminocaproic acid. So this was about TG, and this was a small short topic which I wanted to discuss with you guys today. Last but not the least, I know that exam is right around the corner. All of us are actually pretty anxious with respect to the paper, the date of the exam and everything. But please consider the date of the exam till the same 21st May, till the time a new notification does not come out. कीप ऑन स्लॉगिंग, कीप ऑन स्लॉगिंग. देखो, बार बार डेट के लिए चिंता करने से अभी कुछ नहीं होने वाला. एब्सोल्युटली कुछ नहीं होने वाला. वी कैन ओनली रिमेन फोकस्ड. वी कैन कीप ऑन स्टडिंग irrespective of how tough it is going to be. Keep on slogging बच्चे, and it will be rewarded. There's no doubt about it. So bestest of luck, bestest of luck from the bottom of my heart, and let's hope everything turns out well extremely soon. Thank you, and take care.